heart attacks, right? They happen, part of life.
Heart disease is the #1 killer of men and women still, right?
Exactly, yeah, horrible, horrible. So what you want to do if you're feeling chest pain, you feel like you're having a heart attack, you want to take aspirin as quick as possible. If you're not allergic and you have no other indications to not take it, you want to take an aspirin.
If you are suffering a heart attack, will you always get a shooting pain down your left arm first?
It's not always, and in fact, the tricky part about this is men and women feel heart attacks differently.
Wow.
The classic symptoms that we see in men is that pressure, the elephant sitting on your chest. They don't often happen in women. They have more substernal pain, maybe a discomfort, sometimes radiating to the jaw instead of to the arm. So,
your jaw?
Yes.
So you could be thinking it's a toothache and
Exactly.
you're literally having a heart attack.
Yes, but if you're feeling short of breath, dizzy, chest pain, all of these things happening simultaneously, pop the aspirin, but not just take it, chew it. We found that that absorbs quicker and acts
right, exactly.
faster.
It would get more quickly absorbed.
Exactly.
Right.
And, you know, there's a smaller dose aspirin. What would you call these?
They're like little baby aspirins?
Yeah, we don't call them baby aspirins anymore.
Right.
Because babies don't take aspirin.
Oh,
and that's been a mistake
point.
Parents give children aspirin, and we don't do that anymore because it can lead to a condition known as Ray's syndrome.
It's bad for children.
Yes.
Don't give them aspirin.
So it's not baby aspirin, it's low-dose aspirin.
Low-dose aspirin.
So you want to take 4 low-dose aspirin or the regular strength dose and chew it up.
Gotcha.
And obviously you've called 911.
And I would say get to the doctor
as fast as possible, because time is everything with your heart
That's an ambulance one. Don't let know your cousin drive you.
Yes,
right
away.
You need something with lights.
The first thing you want to do in any accident, irrespective of what it is call 911. But not just to scream, call 911. Point at somebody. Burgundy sweater, brown scarf. You call 911. The reason why we have to point one person out at a specific time is because if we just yell it, everyone assumes that someone else is going to do it for them. And then no one ends up calling, and then the crisis goes even worse than it was initially.
So literally say, could you call 911?
Could you call 911?
You person in the blue thing.
Yes,
blue
exactly.
shirt over there.
Blue shirt over there,
okay.
yeah.
So
assign a role. We do that in the hospital. So
you do, that's right, that's right.
If someone's heart stops, I run in to run the code, which is called the code blue, and I say, you do chest compressions, you give medications, you record what we're doing. Because unless you do that in a crisis, it gets really crazy. But outside of that, once you get the first responders and you're waiting, there's some things you can do. 3 steps, very easy. Write down a list of what medications and allergies you have.
Right.
So write it down before the EMT comes. That'll make the process a lot easier. Find out the health history. So if a person's about to pass out, get it before they pass out so you can help the doctors and nurses out when they get to the hospital.
I'm putting this stuff on a card, man, because if I'm out, I don't want you messing up my groove when I'm out. So,
And then the last part is call your primary care doctor. That's the best part about having a primary, so that we can meet you in the emergency room and admit you if you need it for that continuity of care, because we know what's going on.
Well, for some people, you should find a primary care doctor first, right?
Yeah,
right.
I understand.